COVID-19 does not discriminate between the rich and the poor, but the wider effects of the pandemic have hit some much harder than others. Marginalised communities are bearing the biggest burden. Take Europe's largest ethnic minority, the Roma, for example. A section of society that already felt let down by governments across Europe now feels even less protected by society, finding it harder to access state help. The pandemic has widened the gulf between the haves and the have-nots, and few groups have borne witness to that, like the Roma. Imagine trying to live through a pandemic without the basics you need to keep safe. No running water, no electricity. Well, that's the reality for many of Europe's millions of Roma. The continent's biggest ethnic minority is also perhaps its most marginalised, and the coronavirus pandemic has only further exposed how vulnerable they are.
Crossing the road to a life no one wants to live. A social worker takes us inside this Roma settlement. It's in the middle of a forest. People here are left to fend for themselves.
They are poor, they don't have education, and they're trying to live day for day.
And they are angry. Various politicians have been here, they say, but nothing has changed. They only come when the elections are coming up. They give us some flour, sugar, oil and macaroni, and they think we will live from this gift all year. This settlement started out as a makeshift camp for refugees fleeing the war in Kosovo more than 2 decades ago. That's when Samson arrived. Back then a teenager, now a father of 7 children. He welcomes us into his house made of scrap material. His youngest child is only a couple of months old. I worry a lot because I don't want them to live the same life I do. I've been struggling for so many years. I'm most sorry for my wife. She has to do the laundry by hand. I would buy a washing machine, but I have nowhere to turn it on. With the ongoing pandemic, the children had to drop out of school. Without internet, no access. And then there is the key legal hurdle to improving their lives. We have encountered a lot of problems because I did not have any documentation when I came here. We did not have the time when we left Kosovo. His story is that of so many here. One of their biggest obstacles to proper housing and healthcare, documents. Without IDs, people who live here have become legally invisible in Serbia. There are hundreds of informal Roma settlements, but this camp is one of the worst. People here are living in inhumane conditions with no electricity, no running water. They feel ignored and overlooked by the government. The local government in Belgrade did not want to answer our questions about the living conditions here. Marko Vasiljevic is not surprised. He's been advocating for the rights of the Roma in Serbia for years. Living without access to the very basics is a serious health risk at any time, but especially during the current pandemic, he says. Their health is extremely affected, both physically and mentally, and this may at some point escalate. There are sporadic housing programs for people living in informal settlements, but there is no systematic approach to all informal settlements. He believes this is due to discrimination of a community already marginalized in so many parts of the world. There are already various action plans and national policies in Serbia to improve the living conditions of Roma. Together, they are one of the requirements to join the European Union one day, but such plans and policies require a stronger political will to implement them so settlements like this one cease to exist.
Well, let's discuss the problems facing Roma during the pandemic with Vivian Brashoi from the European Roma Rights Centre. Thanks a lot for joining us. And just explain to us the specific challenges facing Roma during the pandemic.
Thank you. So, the European Roma Rights Centre received reports of Romani people facing lack of access to adequate housing conditions or lack of access to water, electricity, or healthcare. We also heard about situation when ambulance refused to enter a major Roma neighborhood. Also, these communities facing serious backlash on social security support, as they, in many cases, work in informal settings. They are employed informally. So in the financial alleviation packages and relief packages, they are not included. So these issues are adding up to the already bad and marginalized situation of Romani people.
And when it comes to the pandemic and that marginalization that you talk about, where do we see sort of the tangible effects? For example, are governments failing to take into account Roma when it comes to public health protection measures, for example?
I would say that we have not heard yet about serious outbreaks in Romani communities, but we see that, for example, Romani communities are treated differently when it comes to a number of cases. COVID-19 infection cases. For example, in Bulgaria, entire Romani neighborhoods were quarantined. It did not matter how many people were actually infected by the virus. Entire neighborhoods were quarantined with military checkpoints, military forces taking care of not entering or leaving those Romani neighborhoods, and also, for example, with agricultural planes, they sprayed these neighborhoods with disinfectant, which you cannot, I believe, imagine in a white middle class neighborhood. So this is just one of the examples that Romani people faced during the COVID-19. And also another part of this, that many Romani people have, because of the exclusion and poverty, worse health conditions. So they are more vulnerable when it comes to the virus, because as just studies throughout Europe shows, on average 10-15 years, Romani people live less than the majority of the society.
A lot of the problems you talked about, they relate to social exclusion, ultimately. What can be done to improve the situation for Roma?
I think one of the ways to overcome this system of segregation and oppression by racist system is that Romani people are being included in decision-making processes and policies, and also making sure that these big relief packages and financial alleviation measures do not exclude Romani communities. And that maybe means that there are targeted affirmative actions to ensure that Romani people equally enjoy their rights.
Vivian Broscioi from the European Roma Rights Centre, thank you for joining us.
Thank you.
Now, a growing number of countries are suspending their rollouts of the AstraZeneca COVID-19 vaccine over safety concerns. Among them now are the Netherlands, Bulgaria, Ireland and the Democratic Republic of Congo. They've stopped giving the shot following reports of an increased risk of blood clots. But AstraZeneca insists there is no evidence to support that. The World Health Organization is also urging countries to continue using the vaccine. And now is the part of the programme where we put one of your questions to our science correspondent. Here's Derek Williams.
COVID-19 is transmitted via aerosols, so why do healthcare workers wear all that protective clothing?
Personal protective equipment, or more precisely, shortages of it, has been an ongoing issue for many countries since the start of this pandemic. PPE for healthcare workers includes a wide range of gear, from masks to face shields to gloves to gowns. And the point behind all of those products is to provide a barrier between what you want to keep out, which in this case is a respiratory pathogen transmitted primarily via aerosols through the air, and the person wearing the PPE. However, CDC recommendations for people taking care of recovering COVID-19 patients at home don't include ones to wear head-to-foot protective clothing, but only to wear effective masks, and at times to put on single-use gloves. Healthcare professionals in hospital wards, however, are regularly exposed to much higher levels of the virus than a caregiver at home. SARS-CoV-2 can't enter the body directly through the skin, which provides a very effective protective barrier, but it can settle on it and remain capable of infecting someone for a while. Experts now believe that for the average person, the chances of infecting yourself by transferring the virus from a surface where it settled to your face via your hands, that chance is actually quite low. But that danger is multiplied for someone who spends their days in a ward full of coughing COVID-19 patients. So donning items like gowns and other protective clothing is an important way to shield yourself if you work with those people on a daily basis.
And that's all from us. Until next time, take care.